Welcome to the Academy of General Dentistry Podcast Series featuring Dr. George Schmidt. Each episode features experts in the field of dentistry who share insights and inspiration to help you succeed. Let's get started.
Hey, welcome back, everyone. We've got another fantastic show for you today on the podcast here as we welcome Dr. Emma Guzman. Emma is going to be one of our featured speakers at AGD 2026, June 24th through the 27th in Las Vegas, Nevada. So make sure you join us there. Emma, how are you today?
I am doing well. How are you?
I'm doing fantastic. Hey, before we begin, to our listeners, make sure you subscribe to our channel, hit the like button, and ring that bell. That way, you'll be among the first to hear all things AGD. So let me tell everyone a little bit about Emma. Dr. Emma Guzman is a distinguished general dentist practicing in New York City. Known for her dynamic and vibrant personality, Dr. Guzman is not only a skilled clinician, but also a passionate advocate for holistic health and wellness. Her mission to promote a joyful and healthy lifestyle was inspired by her own wellness journey, where the combination of therapy, nutrition, and consistent physical activity transformed her life. Now she is dedicated to empowering individuals to achieve optimal health, both inside and out. And Emma, I got to be honest with you, this is such a this topic touches everybody. It's so important. And let's start out by telling us a little bit about your journey and how you got involved in all this.
So my journey was honestly working every day, having a quote unquote great job as an associate. And what's that? I'm making good money. I have benefits. I have a 401k. I get off of work at 3 p.m. Right. And I'm miserable. I'm not fulfilled. I'm in chronic pain. And one day I emailed HR, emailed my boss, and I quit my job. And no one understood why. I didn't understand why. My family didn't understand why. My mother assumed I got fired, right? She didn't understand why would you quit your job when everything's great. You're a dentist, you make good money, what's going on? And I couldn't even explain why I was so unhappy. I wasn't fulfilled. All I knew is that I was in pain. I couldn't keep living like this. I wasn't taking care of my mental health. Now, I am not suggesting that we all go quit our job, guys. That is not what I'm suggesting. But I'm suggesting that we tune into ourselves so that we don't get to that point. So at this point, I was 7 years into practice. And I am an associate. I'm not a practice owner, but at that point, I've been in many different styles of practice. I've been at a practice that primarily take Medicaid. I've been at HMO practices, PPO practices, fee-for-service practices, corporate DSOs. I've taught at institutions. I've been in hospital-based practices. So I've done a lot of things with dentistry, taken a lot of courses. I am a dental nerd, so I genuinely love dentistry. I love what I do. So it wasn't the dentistry, right? It wasn't the dentistry. It was not being fulfilled, right? But I couldn't tell you what that meant. Like what was fulfillment? What really served me? What was my purpose? I didn't know what that was. And I would say that I don't know if I ever knew what it was past I want to be a dentist, right? I decided to be a dentist in fourth grade. A dentist came to career day, spoke about dentistry, and I decided to become a dentist that day, right? So my life goal was become a dentist. I became a dentist and it stopped there. There was never a conversation of what's my purpose? What's my purpose? What do I do from here? What is there to do now? Right? There was always the obvious assumption of, oh, now the obvious next step is you're supposed to become a practice owner. Right? But the landscape of dentistry is so different now, right? It's so different. when it comes to cost of dental schools, right? What does the landscape look like now with so many corporations? What does it look like now with inflation, right? Like it's so different, and newer docs are looking for different things. But in terms of what was I going through at that moment? Physical pain. Physical pain in terms of back pain. I would have shooting pain going up my back doing nothing, right? It didn't even have to do with me practicing. I would be sitting on the bus and all of a sudden I would have back spasms. I was paying for a chiropractor 4 times a week. I was going to a chiropractor. I was going to physical therapy. I was going to a masseuse. Okay. Oh, so I would, and 7 years out, 7 years out. I haven't been practicing for 20, 30 years, right? So I'm thinking physically, how is this going to be sustainable? Okay. Mentally, let's talk about burnout. I started going to therapy maybe 6 months before that, before I broke, right? I started going to therapy before that. And one of my biggest barriers that I realized was my lack of boundaries when it came to the way I practice, the way I function in the office. A lot of dentists are typically type A personalities. We're perfectionists. We want to do things a certain way. And I'm going to do it because I know that I'm going to do it properly. When it came to delegating tasks to the team, I would do it, and if it wasn't done a certain way, I would just take over and I would do it. You don't let the team handle certain things, or if I let them handle it, I would double check them. So one of the things that I had to start learning is when you delegate things, actually delegate it, right? You have to unload those things, or you're going to break, right? So one, it started with me actually taking care of my physical health. And that's when I was like, okay, I'm going to go to the chiropractor. I'm going to go to physical therapy. I'm going to do all these things, but it wasn't enough. It was really me taking care of my mental health that really was the trigger. When I started taking care of my mental health and I started realizing, okay, I don't even know what my purpose is right now, right? Because my purpose always was become a dentist. That was it. Become a dentist. Now I'm here. I've reached the Mecca, and it may not be all I may have imagined, right? How do we create our story of what being a dentist to each of us individually means, right? How does it align with our purpose in life? What is my purpose in life? If my whole purpose for 20 plus years of my life was to become a dentist, what's my purpose now? So I had to go through that discovery within myself and figuring out how that stressor of not having a purpose, how did that manifest in me physically, not taking care of my mental health, stress, burnout with the profession. How did that manifest in me physically? And when I started to take care of my mental health, it helped me take care of myself physically, right? You make better choices in what you're eating and how you take care of your body if you're clear, and vice versa, right? If I'm waking up early, if I'm going to the gym, I'm probably not going to have a poor breakfast, right? Because I'm going to feel bad that I just wasted that workout, right? So you're going to make better choices with your food if you're moving your body. If you're moving your body, you're going to make better choices with your food, vice versa. I feel clearer, right? Because I started waking up early instead of waking up 10 minutes before I had to leave the house, rushing out the house, getting to work, being on high cortisol, right? Moving in a certain way. So I had to start taking those steps that my therapist was actually telling me to do. A morning routine. We all hear about this, right? Morning routine. Okay, yeah, whatever, right? Once I started actually implementing it, it really did change how I function, right? By the time I go into work now, for example, my day starts at 9 a.m. I wake up at 5. So by the time I start the day at work, I'm already at 11. Like I'm ready to go because I've been awake for 4 hours, right? Pretty worked out. I had breakfast, I showered, like I'm good to go by the time we're starting the day, right? And people are just having their first coffee and I'm ready to go because I changed the way that I look at how I structure my day. And those are just small snippets, right? So I'll stop there because I know I said a lot already. I don't know if you wanted me to pause and to see if you had any questions.
Yeah, so you know what? I mean, fantastic story. And I think that that entire storyline resonates with so many people in our profession. I mean, me for one, I've been doing this for nearly 30 years. And, there were times during my career where I couldn't sleep at night unless I took 4 Advil. I'd have to take, and that was consistent because of the different
Mhm.
things that you describe. And I think so many people have this feeling, but I also think there's so many people out there that feel that way, but aren't willing to either face that or express it to others. And they put
Mhm.
up that facade, like just like you said, like, hey, everything's okay. And no one and everyone's surprised as to how you could feel that way. So what do you say to that person that's kind of that has all those feelings and and is putting up that front for everyone else, maybe the family members, patients, whatever the case may be, and they just can't take that next step to sort of do what you're doing? I mean, what do we say to those folks?
That's why we're here. You have to have you have to have a tribe within our community. Dentistry is so niche. It's so niche. Other healthcare professionals, physicians, dermatologists, no one understands dentists. Only dentists understand dentists, right? You have to have trusted people in our community because you have to understand you're not on an island and you have to have people that you're talking to. Because once I start talking about all these things, then other people are like, oh, you do acupuncture, you do this, you do that. And we start sharing, okay, look, here's my doctor's card. Here's my chiropractor. Try this. Oh, I do acupuncture on my masseters, right? Because I chronically clench and grind. So you try different things once you realize you're not on an island. But a lot of the times it's shame, it's embarrassment, and it's hard to talk to people outside of our community. So that's why I would say, like, yes, I do speak to my therapist, but even sometimes your therapists don't understand the nuances of what you're
Yeah.
saying. So it's important to have a tribe within your community, which is why I felt that it was important that I started speaking to other dentists about it because I know how it is. Because I felt like I was on an island. Because even though I may talk to my best friend about it, I may talk to my mother about it, it's still in the back of your mind, like, oh, I don't say anything because can I complain to someone about a job that they make quadruple what you make? You feel ungrateful sometimes. You know what I mean? You feel like, well, you do well. So like get over it. So she
Yeah.
coming, it's sometimes you feel ashamed to complain,
Yeah.
right? So it's very important to find a tribe within dentistry because I could understand how you could feel like you're on an island or you can't talk about certain things because people don't understand. Also, people who are not in dentistry don't understand how mentally taxing it is and how physically taxing it is. As an outsider looking in, even though I was a dental assistant, even though I shadowed since I was in high school, I didn't know how physically taxing it was for the dentist,
Yeah.
right? Our wrists, our ankles, our knees, our shoulders, our back. I didn't know how physically taxing it was until I was physically doing the work.
Yeah.
It's not really talked about.
There's no question about it. And, of course, at AGD, we like to think of ourselves as a group of like-minded individuals, and it's a place where we can talk about these kind of things. And, we're going to talk a little bit about more specifically about the course you're given. And it's amazing that you can, you can promote this and speak to this. And I'm really looking forward to seeing that. But let me just back up a little bit. So, you said, you just quit. Was that something that you built up to, or you woke up one day and said, you know what, today's the day, I can't take it anymore, I'm done? I mean, or was this sort of a little gradual process for you?
So it was a gradual buildup. It was a gradual buildup where I told my boss maybe 6 months prior that I didn't feel fulfilled. And then he was like, high achieving people never feel fulfilled. And that was his response. You're right. He's like, so because he's just like, yeah, that's why you took that plant course and you took course. And it's like, yeah, I take courses when I start getting bored, right? I learn something new, I do something else. And he's just like, well, you're always taking something new because you feel like you need to do something else. But then it's just like, because there's something else. Like, I need something else. What is my higher purpose? And I didn't feel like a course would do it.
Yeah.
And it was just, I felt that I needed to take time to focus on myself because we are always going to put our patients first. We're always going to paint the scene first. I don't know about you, but raise your hand if you go a day and you forget to use the bathroom, or you don't have lunch, or your water bottle is still full.
Yeah, absolutely.
Many a days. Many a days. So I was just like, I need to take myself seriously right now because I feel my fuse just going. And what I felt was I got to the point, especially when I'm like, okay, we're going on month 6 of me feeling off. And I said, I don't want to get to the point where I'm feeling so outside of myself that it starts to compromise my clinical care. So, what happened maybe a month or two before that? Nothing in terms of the dentistry, but a body cue that I missed. I'm working on a patient, simple, a filling. Okay. Raise your left hand if you feel pain. A simple instruction that we give on a day-to-day basis, right? Raise your hand if you feel pain. I'm working. I see the patient moving, but some people are fidgety. They don't like the sound. People are anxious, what have you, right? I see the patient fidgeting. Are you okay? Yeah, I'm fine. Okay. I continue working. I see her fidgeting. Now, she's telling me she's fine, right? And I could be overthinking because I know I'm off, right? So at the moment, I said, well, she says she's fine. It's the last patient of the day. I'm over it, right? So I keep working. I finish the procedure. It's fine, right? After the fact, she leaves a review, says, oh, I felt it. Now, when I saw the review, my initial reaction was, well, I asked her why she didn't just say she felt it. But I had to take a step back and I was like, I noticed. And if I wasn't feeling off, if I was on my A game, would I not have took those cues to give her more anesthesia? So the dentistry was fine, right? But how was my clinical care at the moment? So now, yes, at the moment, I gave myself the excuse that I asked. But when I really sat there and thought about it, now, is that the biggest, biggest thing? No, but to me, that was enough for me to say, Emma, you're not where you need to be. Your head is not in the right place. So that was maybe a month or two before I quit because I was just like, okay, that was enough for me to say that I don't want to get to the point where it may become worse than that I start to become disassociated from what I'm doing.
Yeah, so that was your tipping point. It takes a lot of courage to do that, and I have a lot of respect for you for drawing that line and saying, you know what, I realize this is not right, and I've got to do something. Emma, we've got to take a quick break, so we'll be right back. This AGD podcast series is sponsored by DHP, one of the largest family-owned full-service dental dealers in the United States. DHP provides dental and medical supplies, equipment repair and maintenance, technology, and equipment sales. AGD members receive exclusive discounts and promotional offers when you buy from DHP. We are especially grateful for DHP's continued support of AGD. Their partnership helps make this podcast and these vital conversations possible. Discover why like-minded general dentists work with DHP by visiting their website at dhpsupply.com. Hey, welcome back, everyone. We're talking with Dr. Emma Guzman here, and she's telling us about her amazing story. And Emma, I want to talk a little bit about in this half directly about your course. So I'm going to read the description, and then let's talk a little bit more about what you're going to be speaking to at AGD 2026. So the title of the course, excuse me, Unveiling the Untold Link: Oral Health and Total Health. Unveiling the Untold Link, Oral Health and Total Health explores the powerful, often overlooked connection between the mouth and the body. This course invites healthcare professionals, wellness educators, and curious minds to reimagine oral health as a vital pillar of systemic wellness. Through clinical insights, cultural context, and holistic strategies, participants will uncover how oral conditions can influence inflammation, chronic disease, mental health, and even intimacy. Rooted in science and elevated by storytelling, this course empowers learners to advocate for whole person care, starting with the smile. And a lot of that you touched on earlier as we spoke, but that's some really interesting stuff. You're going to cover a lot of
Yeah.
ground.
Yes. Yeah. This could be a full day course. Okay. So we're gonna definitely talk about snippets of it, and I'm gonna focus on how this could relate specifically for dentists, right? Because I am gonna be speaking about it at AGD and how we could apply this to our patients and what we could see in practice. So we all know that there are certain conditions that we see in the oral cavity. There are certain things that we could look out for. There are certain conditions that affect us and our treatment. So, what is one of the biggest things that we notice in our patients and that could affect our care? Patients with diabetes, right? Chronic inflammation. How does chronic inflammation in the mouth, patients that have periodontal disease, people that are bleeding a lot, healing, how is that affected by uncontrolled diabetes? So that's going to be one of the biggest things that we touch upon, right? Healing with diabetic patients. Are we placing implants on someone who has uncontrolled diabetes, right? Vice versa. Someone who has uncontrolled periodontal disease, how is that affecting their blood glucose? So it's a two-way street, right? It's not only how does that connect with what we're doing in their mouth, but how does that connect with them systemically? When it comes to patients with high blood sugar, right? All of this has to do with chronic inflammation. That's honestly the one key factor. And when it comes to chronic inflammation, stress is a big factor, right? Cortisol increase, stress, cortisol increase, inflammation in the mouth, right? The mouth is the gateway to the rest of your body. So almost everything that's going on, especially now that people are doing so much research on all these different conditions, they're finding markers in your mouth for everything, right? We're connecting it to Alzheimer's, right? We already knew the connection with endocarditis, right? We have the connection with hypertension, right? Now we know that there's a connection specifically with pelvic issues, intimacy issues, specifically with jaw tension, grinding and clenching, right? The musculature in our jaw, same musculature that's connected to our pelvis, right? The vagus nerve connected to our jaw, same nerve connected to our pelvis. All of that is connected, that tension, right? But all of that is due to cortisol increase, right? So if we think about our stressors, right, which is why when I talk about mental health and how that's connected, right? All of that is connected, right? How does mental health affect our oral health and vice versa, right? Hi, Emma, I suffer from anxiety. I don't notice it, right? But how does it present? I'm a chronic clencher and grinder. I've never noticed it. You know who noticed it? My dentist. Okay. When I was 18 years old, right? And it wasn't even my treating dentist. It was a dentist that I shadowed. I'm having a conversation with him. I'm like, hi, how you doing? And then he's looking at how straight across my teeth go. He's like, you need a night guard. What? You need a night guard. That talking about, right? Because he just sees, he's like, your teeth are straight across. He's like, I'm sure some people look at it and they say it's really nice. But right. And I don't feel like if you told me that I have anxiety, I'm like, I know people who have anxiety. I don't have anxiety, right? My anxiety presents in a different way, right? I catastrophize, right? I make up stories, right? I plan a whole conversation before it happens, right? Like it's not the same as the other people who are like worried about things, and they're like, that's anxiety. That's just a different presentation of it, right? So how does that present, right? I grind and clench my teeth. Why is that an issue? Right? Because I'm gonna have no enamel by the time I'm 80, right? Because I broke my tooth and that's why I have an implant, right? Because I wasn't complying and I didn't get that night guard. So now I could joke about it, right? But how did that affect the rest of my body? Probably because my shoulder lives at my ears, right? That tension that I have in my body, I'm sure, along with the dentistry, I'm not going to not include the way we sit, but I'm sure that's a contributing factor to my back pain, right? All that tension, all that increased cortisol, right? Because I sit like this all day, right? When I drill, I know I drill with my shoulders up, right? I have to think about putting my shoulders down when I'm working. All of that is connected, right? If you have familial history, right, of certain chronic diseases and you're in a high stress state, right, you have to be more conscious of decreasing your stress, right? I know I have familial history of hypertension. So I had to make sure of the things that I could control, right? So I had to make sure I'm controlling my diet, I'm controlling my nutrition, I'm controlling my environment. So I keep my stressors low, right? Because I'm already predisposed to certain conditions, right? So these are certain things that when I'm speaking to my patients, I'm like, okay, you're here for this. Okay, I'm seeing certain things. All right, I see a little bit of an imbalance in your masseters, right? I don't say masseters, right? I say your jaw muscles. I'm seeing a little bit of imbalance. It looks a little bit uneven. Do you notice that you clench your teeth? No, I don't clench my teeth, right? And I say, okay, if you're ever in trivia, I don't know if they're going to ask this, but you're only supposed to have your teeth closed when you're swallowing. When you're at rest, your teeth are supposed to be slightly open. So if you close your mouth, you saw my muscle moved a little bit, right? That's clenching. If you're at rest and your teeth are closed, that's clenching. A lot of people think clenching is I'm closing really tightly. If your teeth are closed, that's clenching. So if you're doing this all day for many, many years, right? That's a lot of tension that you're putting on your body. All these muscles are connected, right? So if that tension's on your jaw, it's on your neck, it's on your shoulders, on the rest of your body, right? So that's something that you have to think about, right? So when we're talking about that, and then we're getting into their medical history, and then I start talking about what they eat, because that's all affected as well, right? Your diet is going to affect what's going on in your mouth. I have a patient. I brush, I floss. Why do I have cavities? What are you eating? Right? That's systemic health. What are you eating? Because people do come with these questions. Right? I'm doing all the oral hygiene, right? The answer is not always floss. Right? Some people are doing their oral hygiene routine, right? But they have seltzer every single day. Right?
That's so very true. And what I love about what you're talking about is not only does it apply to the patients, but it also applies to us, right? I
Yes.
mean, this is a topic that crosses over everything. We only have a little bit of time left, but I want
Hmm.
you to share in the final minutes that we have here some of
Yes,
the, I know you're going to talk about some holistic strategies that you can
yes.
help. Just touch on that a little bit,
Mhm.
and then we'll see where we go.
Okay. So one of the things that I think have been amazing is not for everyone, but acupuncture and dry needling are great for stress relief, and specifically in the muscles. A lot of the tension that we carry is in our muscles. So acupuncture and dry needling has been so helpful to me in combination with physical therapy. But in terms of the day to day, what I have done with myself is honestly preparation and nutrition and movement. That's the most holistic you could go. Okay. Preparation, movement, nutrition. Okay. What do I mean by preparation? Plan out your day. The same way that we have a schedule in our office, schedule when you're going to move, schedule how you're going to eat. So I schedule when I meal prep. I meal prep on Sunday, I meal prep on Wednesday. I have those 2 hours allotted. And depending on if I do it twice a week or once a week, I'm able to meal prep in an hour. But that's because I've gotten it down to a science that I'm able to meal prep very quickly. But when I started, I did 2 hours on Sunday, 2 hours on Wednesday. Okay. Those were because Wednesday is my shorter day of the week. So I'm able to do it. Right. My movement, I would look at my schedule. If I have meetings in the afternoon, or if I have to go to an event or what have you, I would know, okay, these days I have to go in the gym in the morning. These days I'm going to go to the gym at night. This day I'm going to take a walk. This day it's going to be my rest day based off what's going on. So the same way you schedule your meetings, schedule your movement, schedule your nutrition, right? I have a weekly meeting with myself, okay, to plan my week. So every Sunday, I plan my week. Morning routine. I wake up every morning, I journal, I go to the gym. That's my morning routine. Okay. I tried meditation, I fall back asleep. It's not my thing. I can't do it. Okay. I fall back asleep. When it comes to movement, I'm not one person that believes that like you have to go to the gym. Do what you enjoy, whatever movement is for you. If that's swimming, if it's taking walks, if it's going to the gym, if it's dance classes, whatever movement means to you, do that. Okay. You have to do something that you enjoy because it has to be sustainable. Okay. If that's a walking pad in front of your head, if you enjoy watching TV, get a walking pad and watch your TV with on your walking pad. Okay. There's times I get on my bike and I watch my shows while I'm working out. Right. So I'm like, I'm at least doing something. Right. I'm about the path of least resistance because I want what you do to be sustainable. Okay. When it comes to nutrition, I don't want to take away things initially. I want to add, right? What can we add more of? Let's add more water. Let's add more vegetables. Let's add more whole foods, right? The first thing we want to do is let's clean the kitchen, right? Remove as much processed foods as you can. Remove as much canned and box foods as you can. Now, are there certain things that it's just not as feasible to not have canned and not have like, yeah, there's certain things that I have canned and certain things that I have boxed because it's just easier that way. We live in we don't live on farms, okay? It's just easier that way. But minimize that. I You do have to go to the supermarket every week to get fresh vegetables. If that doesn't work for your lifestyle, okay, maybe get it frozen instead of cans. It's just certain choices that you make your nutrition more whole. Okay. Do I eat out? Yes. Do I eat fast food? Not really. Right. I don't, and that's just a choice. Right. That's a choice. I'm not dogging it. If you do eat fast foods, there's still better choices to make. Right. When I have Chinese food, I don't eat right. I don't eat the rice. Right. I have shrimp and broccoli, extra broccoli, right? So there's certain choices that you can make even if you're eating fast food, right? So when I say we're going to live a more holistic life, right? I mean, how do we move our bodies? How do we add more whole foods to our lives, right? I feel like it's harder when we think about it as taking away things. And I feel like a lot of the times when we want to change things, when we think about, oh, to live cleaner, we have to take away. How do we add? So that's what I want to talk about. How
Yeah.
do we add? And how do we do that for our patients as well? I talk about the same thing with our patients when they tell me about all their seltzers and, energy drinks that they're drinking. I'm like, okay, let's do that for one meal. And maybe the other meals, let's do water, right? How can we add more things versus taking away to make it more sustainable?
Well, listen, there's no question that you've got a comprehensive strategy. You've come a long way since the day that you quit your job. That's for sure. And we're out of time, but I can say this: when at AGD 2026, I've got a busy schedule, but I'm going to be sure to come and see your course because I think it's going to be fantastic, and I really look forward to hearing more about this. But for folks that want to maybe reach out, ask you a question, how could somebody get a hold of you?
So my email is Dr. Emma, so Dr. period EMMA at dremmaguzman.com. That is my email. And then my Instagram is underscore Dr. Emma.
And Guzman is Guzman.
Yes, sir.
There you go. So thanks so much for coming on the program. Really had a wonderful time speaking with you. I'd also like to thank our producer, Kristen Gover. If you like what you heard, please like and subscribe to our channel. You can always find us on Spotify, the AGD app, SoundCloud, Apple Podcasts, and of course, YouTube under @General Dentistry. If you have any questions, concerns, or comments, you can reach us at news@agd.org. Thanks again, and we'll see you next time.
Thank you for having me.